Hi, this is Dr. Paul Chasan at Ranch and Coast Plastic Surgery, and I'm going to be talking about facelifting. So facelifting has changed dramatically over the years. In the 1950s, they did just skin-only facelifts and removing skin and pulling, and that never really looked good, nor did it have much longevity. Then the 70s and 80s came the SMAS lifts. If you look at the superficial muscular aponeurotic system, that's the SMAS, that's the fibrofatty covering of the muscles, of the facial muscles, and that has a little bit more structure and doesn't stretch as much as the skin. And that really helped improve facelifting overall, and that's what kind of projected facelifting into the new era. But the problem with that is longevity. And the longevity still, instead of being 6 months or a year, was 3 to 4 years. And we're really looking for, 10, 12, 15-year longevity. So what's changed a lot, I'm going to show you on the film up here. If you look here, what changed for me about 12 years ago or 13 years ago was this marionette line. Everybody has a marionette line. And so in her case, we suctioned here, but fat transfer into this area changed everything. And so we started learning that fat transfer there, fat transfer into the jawline, fat transfer into the lower eyelids really rejuvenated the face. And so what we started to notice is gosh, you could have a really great result, but by adding fat, you got stem cell rejuvenation of the skin. A youthful face has more fat. And so patients not only look better, smoother, but they got more rejuvenated. And that was a big thing. Then what started happening is I noticed there's some people that still their necks weren't as good as I'd like them to be. And so about 8 years ago, I went and learned how to do submandibular gland excision. Not many patients need them, but the ones who do is an impressive amount of improvement in the neck. So I'll show you here. Here's a perfect example. She had a facelift, but you see that little bump there? Well, that little bump just ruins the whole smoothness of the neck. And you can see here, removing her submandibular gland, just a portion of it, really helps improve the neck. I've done hundreds. I've done more submandibular gland excisions than anyone in San Diego. And I think it really helps improve the result in some people. They always ask, do I get a dry mouth? No, I never had a dry mouth. And you really have to understand the anatomy there. And I call it part of the undercarriage of the neck. This part of the neck has some mandibular glands, has digastric muscles, has subplatysmal fat. And the idea is to recontour that area and not necessarily pull. And then the last piece of the puzzle is deep plane facelifting. So our problems have always been, if you're pulling from up here in this area, the farthest part of pull is here, and this nasolabial fold area has always been difficult for us to get improvement, but you can see what an improvement we've gotten here, and I feel like deep plane facelifting has really improved that. And what is deep plane facing? Well, actually, we're going not only under the skin, we're going under that SMAS layer, the fibrofatty covering, and we're releasing all the way out to the nasolabial fold. Now, the last piece of the puzzle has been fixed, improving this area and longevity. This will last for years. And so what I found is with the deep plane facelifting, if you release, there's lots of little ligaments that are more forward in the face. If you're releasing those things, now when you're pulling, you're not pulling so tight. And the key is to release, recontour, and then you're not pulling very tight. Now, if you do that, then you're not getting the stretch back that usually would occur. So I think the modern facelift today incorporates deep plane facelifting, recontouring in the neck, fat grafting, and an occasional removal of submandibular glands. And if you do all those things, you can have a beautiful, balanced result that doesn't look pulled and has longevity. My patients now, after using those techniques, have much longer lasting facelifts.